Good morning, everyone. My name is Agumati Judalova, a 200 level public health student of the Joint Professional Training Support International, presenting a term paper titled The Presence of Hepatitis B Envelope Antibody in Patients Who Have Been Previously Screened for the Surface Antigen. According to the World Health Organization, hepatitis B is a potentially life-threatening liver infection caused by hepatitis B virus. This infection is infectious and can lead to liver complications such as hepatocellular carcinoma or liver cirrhosis or even liver failure. With more than 325 million people diagnosed with the infection across the globe and an estimated 820,000 deaths in the year 2019, hepatitis B is considered as the 10th cause of death in the world, and in Asian and African countries, hepatitis B is considered an endemic. Its mode of transmission includes mother to neonate, having sexual contact with an infected person, being exposed to infected blood or body fluids, especially among healthcare workers, and sharing of infected items such as razors. Hepatitis B is a hepatotropic DNA-containing virus that replicates via reverse transcription. The diagnosis of hepatitis B infection is based on clinical, laboratory, or epidemiologic findings. Serologic tests are conducted on individuals to diagnose and detect the level of infection. These serologic markers used include hepatitis B surface antigen, antibody to hepatitis B surface antigen, antibody to hepatitis B core antigen, hepatitis B envelope antigen, antibody to hepatitis B envelope antigen, and hepatitis B virus DNA. Hepatitis B infection can be based on two phases. The first phase includes acute infection or chronic infection, which is the second phase. The acute infection is diagnosed by detection of hepatitis B surface antigen and antibody to hepatitis B core antigen in an individual. The loss of hepatitis B surface antigen and the development of hepatitis B surface antibodies indicates recovery from acute infection and immunity development. In the chronic infection phase, there is persistence of hepatitis B surface antigen and antibody to hepatitis B core antigen, whereas there is absence of hepatitis B surface antibodies in the individual. In this stage, the person is said to be in a carrier state, and these carriers are often asymptomatic. In a duration of 6 months, the presence of hepatitis B surface antigen leads to the presence of hepatitis B envelope antigen. Its presence, that is the hepatitis B envelope antigen, correlates with viral replication, high viral levels of hepatitis B virus DNA, and high infectivity. During recovery state, there is a process that occurs which is called seroconversion. Here, there is loss or reduction in the presence of hepatitis B envelope antigen, and there is a presence of hepatitis B envelope antibody. Its presence, which is the hepatitis B envelope antibody, correlates with decrease in replication virus level, replicating virus and lower infectivity. Nevertheless, the reversion to hepatitis B envelope antigen is possible if care is not taken considering the mode of transmission. Recommendation: antiviral therapy should generally be initiated in patients with chronic hepatitis B virus infection Persons with acute or chronic infection should prevent their blood or other potentially harmful fluids from contacting other people. They should also stop sharing items such as their toothbrushes or razors with their friends, families, or loved ones. In the healthcare settings, patients with hepatitis B infection should be managed with standard procedures and, most importantly, be vaccinated. Thank you for listening.